Welcome once again to this VUKA show. VUKA is a Zulu word and as well as a Kiswahili word. In Zulu, it means arise. In Swahili, it means cross. VUKA is a show that is targeted at policymakers to have a perspective from the civil society and communities that are affected by tuberculosis. And the objective is to have a discussion on how can we make access for healthcare in Kenya, in Africa, more easier, make healthcare more accessible. And on our show, we are going to be having persons with various experiences, various technical experts in matters around TB. But first thing first, before I continue, I want to give a message of condolences to our brothers and sisters in the Republic of Tanzania following the loss of their president, His Excellency Joseph Pombe Magufuli. Brothers and sisters, we are together in this. It's really sad. Back to matters tuberculosis. Tuberculosis is the leading infectious killer globally. It's sad that in 2019 alone, we lost about 1.4 million people to this curable and preventable disease. We need to stop these unwarranted deaths, and the only way we can do is doing things differently. And one of the most important things is hearing from communities who have walked the shoe of tuberculosis. And today we have a very amazing guest I'm going to introduce shortly, but before I introduce my guest, I want to invite all of you, our virtual participants. We are live on Facebook, we are live on YouTube, and also on Twitter. Feel free to ask questions, give your inputs, give your recommendation. Let's all make contributions in this very amazing, exciting conversation. Next, let me just without much ado, invite our guest, who is none other than Norman Kagiso from Botswana. Norman Kagiso, welcome. Tell us who you are.
I thank you for having me in this show. I welcome all the viewers and all the everybody watching this show. My name is Norman Kagiso Matiting. I am from Botswana. I am a multi-drug resistant TB survivor, and I am currently the chairperson of the TB Champions Association of Botswana under Global Victors Botswana.
Thank you, Norman. Maybe for the person who is joining us for the first time and maybe who has not engaged in the TB conversation, kindly tell us in a few seconds, what is MDRTB?
MDRTB is a type of TB that is resistant to one or more of the tablets that are provided for first-line TB or drug-sensitive TB.
There you have it from Norman himself. Norman, what motivates you to work on TB after going through that very painful experience with tuberculosis, I believe? What motivates you to still work on this disease?
This disease is curable. Anyway, let me just say, when I was admitted in hospital in isolation for this disease. But when I got there, I had lost weight. There was a lot of things happening to me. But in a short space of about 3 months, I saw differences in my body weight, and then I saw that now I'm getting healed, and then I saw that this disease is curable, and it gave me the courage now to go and tell the world, other people, that no, they shouldn't fear about this disease. This disease is curable.
How long was your treatment?
My treatment was 20 months, but 20 months with pills and injection every day, but injection for 6 months. I stopped injection after 6 months and continued with the tablets for another. I was supposed to go for 18 months. I went for 20 because somewhere down the way we had drug stock outs.
Oh, I believe that was not easy. 6 months
Yeah,
injections. We shall come back to that.
Okay.
Having gone through that experience and having now worked with persons who have had TB, what would you say are the barriers that are hindering access to TB care?
The barriers are maybe lack of finance, maybe to reach the facility, one. And the next one, maybe ignorance about the disease and stigma.
Okay, finances, stigma. You said what else?
And ignorance about the disease. Not knowing about the disease, yes.
Okay, ignorance, not knowing about the disease.
Yeah.
Okay, now that you know these barriers, what recommendations would you want to make to the government and other stakeholders, who I'm sure some of them are watching us today? What recommendations would you want to make to them to improve access to TB services and care?
TB survivors, I mean, TB patients, especially in hard to reach areas, should be provided with transport. Transport if in case there's no transport, they should be supported with incentives. They should be given cash incentives so that they could reach the facility to get diagnosed and get initiated on treatment. And yeah, I think that they should be provided with financial incentives.
Okay, Norman, your network is breaking, but I got what you said, that you would recommend that the government provides transport as an incentive for people who are living in hard-to-reach areas to access care. And what recommendation would you want to give about stigma? And this should be maybe to the communities.
The communities actually should accept, socially accept the people with TB. I mean, they should reintegrate them into the society. They shouldn't look them down upon. You see, to stop stigma, because if you stigmatize a person, this person is going to he or she is not going to go to the clinic to access treatment or diagnosis because of fear of stigma.
Sorry, we are having some technical challenges with Norman's network. I believe we shall be working on that very soon. But Norman is making a recommendation, very key, that one, the communities need to support those people who have been diagnosed with TB in their treatment journey. And he also says that we need to reintegrate these people after they have completed their treatment so that they don't feel isolated, they don't feel stigmatized. I hope I got it right as you have put it. And Norman. Norman, you told us that you took your treatment for 20 months, including injections. But now we have better technology, we have shorter treatment, and we have treatment that doesn't involve injections, which is injectable free for drug resistant. What recommendations would you want to make for environment? Like what other areas do you feel can be improved by investing in research and development?
Like now, my opinion is I still feel we still need to improve on the regimens. Maybe we must try to reduce the period of for drug-resistant TB. We should maybe reduce it to 6 months, and then the drug-sensitive TB for 4 months treatment.
Okay, so shortened regimen. to 6 months and
short-term
maybe
regimen.
4 months. Okay.
With
okay.
no injections. With no injection.
Definitely with no injections. I think nobody loves injection. Yeah. 2020 came and boom, COVID came and no one was prepared for COVID. I know now that you've been working with infected communities, how would you say COVID response has affected or impacted on TB response in general?
It affected TB response in the way that patients that were on directly observed therapy, or who went to the clinic every day to go collect their or to have their medication, they couldn't go there because of the lockdowns. They couldn't go to take their prescriptions because of the lockdowns. And those who had symptoms, who were presenting symptoms, couldn't also go there for diagnosis. So really, COVID-19 took us some years back on the fight against TB.
Thank you. Naman says COVID has taken us many years back to where we had come from in TB response. And one of the barriers has been because of lockdown, people could not access services. And I can see comments from our online and our virtual participants, and I'm going to throw one of the questions to you, Norman. This is from Mombasa. What is the support needed to support those on treatment to successfully complete the treatment? Yeah, you completed the treatment. What sort of what of support do you feel is required?
For treatment, we need psychosocial support, emotional support. You know, we need support from all corners. I wouldn't say financial incentives for treatment of TB. Oh yes, maybe to provide transport for those who are in need to go for that directly observed therapy. We could have such incentives for those people.
Okay, thank you. And there's another question. How did you beat stigma? Practical tips on how you are able to beat stigma.
Stigma. I beat stigma. I'm a specialist in beating stigma.
How did you do it?
I just couldn't. I don't know how to put it. I know how to actually, when you stigmatize me, I wouldn't be angry at you. I would sit you down and let you be aware that this disease is curable and treatable.
So counseling,
awareness campaigns, reach and what do you call this? Public reach out to the public through social media or the radio or TV.
Okay, so more awareness is what is required for us to address stigma. Thank you.
Yes, and No, and I was going to add that people must be encouraged to come into the open. I mean, if you come into TB is not some like other diseases that are not curable. So we should encourage people to come out and just tell the people that this disease is curable when you are cured. Okay.
In 30 seconds, tell me what sort of support do you feel should be given to networks of TB champions or TB networks? In just 30 seconds.
Communication facilities. We should be given smartphones, tablets, laptops, so that we could maybe communicate with others who are in hard to reach areas, and for using social media. I've got I use social media to use awareness through my Facebook page called TB Must Fall.
TB
must fall.
TB must fall.
Yeah, TB must fall down. Yeah.
Okay, thank you so much. That was Norman sharing his experience with TB, and he has made very solid recommendations on how we can improve access to services, how we can beat stigma, and how we can support the TB champions networks of communities that are living with TB. And I will emphasize on the recommendation he has made on the network of TB advocates. We are living in a digital world. We cannot live in the analog world and expect to make a change. Therefore, we need to support the TB champions and communities to be digital, to ease the creation of awareness and how they interact and pass information, and also share their experiences to the rest of the world. Thank you so much, online viewers, for being with us, and Norman for having the courage not just to go through the medication, but coming out and using experience to teach others, and nobody else goes through the experience that you did. Thank you so much. Look forward to the next show. It's here. VUKA show is a place to be.